COVID-19 vaccinations are moving slower than planned. Less than 180,000 healthcare workers have been vaccinated so far. Government has moved its deadline from the end of this month to mid-April. Heidi Jarkos is tracking developments for us. She joins us now live. So that initial plan was to inoculate over 1 million healthcare workers by the end of March. What's government saying about the new plan?
So what we understand from what the Deputy President David Mabuza indicated yesterday afternoon after he visited a biovac facility in Cape Town, that the plan to inoculate over 1 million healthcare workers by the end of March will not be met. I actually went back, Shahan, to listen to whether or not the deadline for mid-April will be definitely met, and the Deputy President saying that it might be met with regards to inoculating over 1 million healthcare workers by the end of or by mid-April. This is, of course, great concern, and there's mounting pressure for government to try and procure as many vaccines as possible and to get the vaccine rollout on track. As you currently know, Shahan, the vaccine rollout that we're seeing is actually on a trial basis. This is how government was able to get the Johnson & Johnson vaccine into the country after the AstraZeneca vaccine program was put on hold. And this is causing limitations and challenges for government because they cannot bring over 1 million vaccines into the country until it's actually registered. And we do know that for now Pfizer has been registered, and government is indicating that those vaccines will come at the end of March. But of course, the Deputy President admitting that this process is going at a very slow pace, and there's very big concern that now that we're moving into the third wave, what is going to happen to healthcare workers and those that have not been vaccinated. Let's listen to the Deputy President.
In terms of our plan, the first quarter, which is supposed to end end of March, we're going to deal with all health workers. Then the second phase will be starting in April. Then we're dealing with all other frontline workers, your teachers, your police. So I see us pushing back. Maybe the second phase might start the second week of April, because we must finish our frontline, our health workers, and we must reach that million. That was according to the first phase.
So, Heidi, of course, it's certain now government isn't going to meet its first phase vaccination target. What are some experts saying about the delays?
So some of the experts we've spoken to, and you actually hear from the Deputy President indicating that the issue is not with government systems and implementation with regards to rolling out the vaccine. It's rather the fact that there is a global fight and global shortage with getting the vaccine. And of course, because government was thrown off by the AstraZeneca vaccine being put on hold, government needed to get together a program to try and at least vaccinate as many healthcare workers as possible. So we do know that there is most certainly a global shortage. And of course, countries, Shahan, more developed countries with bigger purses are able to procure the vaccine much quicker. And there is, of course, a massive delay with trying to get the vaccine into South Africa. We know that it comes, especially the Johnson & Johnson vaccine, it comes from the US. It then needs to be shipped to Europe and then rebottled and then shipped to South Africa. So we know that initially we were supposed to be getting 80,000 doses every second week, and then a batch of 60,000. That, of course, is not happening. As soon as the vaccines are ready, they bring them into the country. But what experts are saying is that it's not a system problem. It's rather the fact that there are no vaccines. Let's listen to what Mia Malan had to say about that.
Yesterday, Thursday, we had vaccinated just short of 180,000 health workers, and that's a little more than 10% of the 1.25 health workers that the government says we need to vaccinate, although they've said it's likely to be a little bit less than that. So the health department has previously said they wanted to start with phase 2 of our rollout at the beginning of May. And how will we get there, and will we even get there? So if we look at numbers, the Sisonke trial, which is currently the only way to access a COVID vaccine in South Africa, they have 500,000 Johnson & Johnson doses, and they are aiming to have used these doses by the end of April. So by the end of, when April comes, we will only have, if we just go with the Sisonke trial, we would only have vaccinated less than half of our health workers. So to make up the other numbers, the other 750,000 that would be left, we would need to use vaccines that have been approved in South Africa for use beyond a research setting. And there are two vaccines that have been approved, AstraZeneca and Pfizer. AstraZeneca we can no longer use because of the new variant, and that leaves us with Pfizer at the moment. Now, Pfizer is a little bit more complex to use than Johnson & Johnson because it has 2 doses and not just 1 dose like Johnson & Johnson, and it's also more complex to store. And there are also huge complications with availability. Everyone in the world wants this vaccine, and they just can't manufacture enough to provide enough vaccines. So just because the government has ordered or procured 20 million doses doesn't mean there's going to be stock. It doesn't mean we're going to get all of these vaccines at once.
Yeah, so when can we expect more vaccines to arrive in the country?
Well, that's the million-dollar question, Shahan. We have been trying to reach out to the Department of Health to try and get a further understanding of when exactly we will be getting more vaccines. We know that some vaccines arrived throughout the week, and as previously indicated, we know that as soon as vaccines are available, they are shipped into the country. But we know that a consignment might be arriving tomorrow. We're not sure how many doses, but we do know that BioVac is on standby to receive those vaccines and make sure that they are transported to the warehouse and then taken to the various vaccination sites. But as soon as the Pfizer vaccine comes in, Shahan, and government's predicting that it will be by the end of March, there is going to be pressure on government again to make sure that those vaccination sites are equipped to keep and store that Pfizer vaccine as it needs to be, cold at extreme temperatures. And of course, it's 2 doses that need to be administered, one and then the next after 21 days.
All right, we're going to leave it right there.